Hi again. Today we'd like to talk about another topic that I'm very passionate about, especially as a nurse. I work in Florida as a nurse, and one thing that I've always been is a health advocate, a title that I really take to heart with me because I'm very passionate about my patients, and when I meet them, a lot of them I feel they in the health field they haven't had anyone that advocated for them, and so by the time they come to me, there is a learning curve and telling them, educating them about their rights and when to contact their health insurance, when to contact their primary care, when to demand certain tests or demand certain accountability for their own health. Okay. So today I'd like to speak to you. It's a huge topic, so I'm not going to go into a lot of detail. I'm going to do it step by step. I'm not going to do a whole video of that. Again, my name is Nurse Maggie. I work in Florida as a nurse practitioner. If you ever need anything in Florida, please don't hesitate to give me a call. But anything that I'm talking about today, it's actually best to speak with your own doctor. If you have any questions specific to any of your medical needs, okay? This is strictly some advice that I would generally tell my patients if they were to come to talk to me, okay? And so today we're going to start with tip number one. How do you advocate for yourself? Effective healthcare advocacy, okay? Number one, I would also say, like, especially people with chronic diseases like diabetes, COPD, high blood pressure, high cholesterol. Um, if you have a long list of chronic diseases, you need to know what you're taking. What are your medications for? Okay, so if you are going to your doctor's appointment, it would be time for you to review with your doctor. Why am I taking this medication? Because in my line of work, I've seen a lot of patients with polypharmacy. That means they're taking so much medication that has contraindicated side effects that will cause more problems down the line. So the first thing I would tell any of the patients is to know why you're taking a medication. Okay, so first thing first would be prepare for your appointments. Have a list of your medications, okay, there with you that you take. So some people, they will ask you, bring in your bottles of your medication, but you personally should make a list of your medications. In case of an emergency, you may not know what your medications are. It could be a heated situation, so have a list of your medications with you, okay? And then if you are not aware of what they are, when you get to your primary care doctor's office or whoever you're seeing related to that medication, whoever gave you the medication, you would then say, okay, I'm taking this medication. Let's say lisinopril. Doctor, why am I taking this medication? And so the doctor will tell you, you take it for high blood pressure. Okay, how am I doing? Okay, that would be the time you have the conversation with your doctor to find out, how you're doing. But you would make a note. This medication is for this high blood pressure. If it's your primary care physician, go down the list of your medications, find out why you're taking your medications. Verify with them the time that you have to take your medication. Is there any side effects of your medication? That's being self-advocate for yourself so that you have empowerment now that you're taking your medications. And also it also allows you to cross check. If you go to the pharmacy, they give you something that was not discussed with your primary care physician during the appointment. Find out, hey, my doctor did not tell me I'm taking this medication. Why am I being prescribed this medication? So you can always call the doctor's office and have them clarify it, okay? So it's best to bring for your first appointment a list of the medications you're taking. Find out why you're taking it and write down next to it high blood pressure, high cholesterol, diabetes type 2, whatever the medication is for. You are now empowered to know this is why I'm taking it. Okay, and if you're taking it, know the time that you're taking it. Some medications need you to take it early in the morning, like levothyroxine. You have to take it first thing in the morning. Some medications have to be taken with meals. Some medications have to be taken at night. So you would write on your note again, nighttime, morning, lunchtime, and so forth. Okay, so it's best to have that. Having this knowledge of what your diagnoses are. Now that you have your list of medications, now you know also what your diagnoses are, and you are empowered to talk to your primary care physician about the treatment plan. Like, do I really need this? And they might tell you, if we need to do this for this amount of time. It could be an antibiotic short term. It could be we're going to do it for 6 months. So you just talk to them to find out the plan of action for you. Okay. So let's see. Having this opening with your primary care physician, it allows you to build trust in the process, because you're not just saying, oh, I just walk in here and they just talk to me and send me home. Now you are empowered with your list and you know what you're looking for. If it gives you a tool, okay, that you can use to help understand your disease process. All right, number two, number one was prepare for your appointment. Number two is to ask the right questions. Okay, so if you are talking to me as a provider, and I tell you something that you're not too sure about, you can clarify whatever I am asking by saying, Doctor or Nurse Maggie, what is your opinion, about a endoscopy or a colonoscopy? That way, we can have an open conversation. So asking the right questions. If a provider approach you and tell you to do a certain step that you are not aware of, please ask them for their advice. What is your advice? Always clarify that. Ask what are the risks? What are the risks or the benefit of a treatment, a procedure? You could get that clarified. And then you could also say, if you are giving a new medication during an appointment, you ask, how does this medication affect my other medication routine? Is there a side effect that I'm not aware of? Is there anything that will change with my treatment because you have put me on this new medication? Okay. Some patients are not able to advocate for themselves, and I've seen this as well. Patients who have memory issues, who have language barriers, or meaning like they speak a second language, a different language. They don't have they're not mastered in their English is not their first language. Okay, so those patients will need to maybe ask to have somebody translate for them. Most facilities have translation lines. So basically, for example, if I speak Creole. Okay, so if I speak Creole and I go in to a doctor's appointment and I have no idea what the doctor's saying, but I shake my head that I know what you're saying, but I do not. It could be dangerous. You don't want to do that. That's why you want to ask, is there anyone that speaks my language, Creole? And most likely they will get you a translator. If that is not possible, feel free to bring a family member that can advocate for you, and so that if you're having a challenge and during the visit, for example, you have a test that is really abnormal, you have a procedure that's upcoming, a surgery, you can bring a friend, you could have a family come to take notes, to ask questions, to be a support for you. The environment doesn't look too intimidating. Okay, sometimes our clinics can be very intimidating. They're white, starch, bright light, and some people are afraid of going to these type of facilities. So feel free to bring somebody with you and tell them that you need to be accompanied at the time. Um, Also, understanding your rights. That's a real big thing. When you're signing procedures, you're signing any forms, read your rights. You know your rights. What are you informed consent forms telling you? What are you consenting to? Do you have the ability to get a second opinion? Which a lot of, like, if you had a specialty, if you were sent to see a specialist, let's say, for example, I have COPD and the doctor says, well, I can only do a bronchoscopy on you. And if there is something further that is unexplainable, that you don't feel comfortable with what is being told, like I wouldn't feel comfortable. Well, I don't want a bronchoscopy, I want to get a second opinion. So you have the right to speak up and say, I would prefer a second opinion, and before I do this procedure, I would prefer a second opinion. That is your right, and find out from your doctor, of course, if that is something that you can do. What is their opinion about that? Access to your medical records. You have the right to get your medical records. Now, some facilities, they have their own procedure, but if that is the case, if there's something on your records, especially now with the new EMRs, there you could get access to your medical records after a visit. So, but if you have like an older EMR where you need to have EMR, electrical medical records, if you need to have something in writing, a copy of a test or lab tests, or a x-ray or anything like that, you want a copy to bring to another provider, ask for a copy during the interview or during the visit, and see if they'll give it to you at the front desk. Okay, let's see what else. So overall, knowing these skills, and these are the things I always wish I can tell all my patients, having these tools that you need, that helps to empower you, that helps to decrease your stress of going to a doctor's appointment, and it gives you informed decision. It allows you to make informed decisions, and not just be treated as, okay, go get this test done, go get this lab done, here's your medication. But knowing this, having in writing what you're taking, why you're taking it, and so forth, it gives you, helps to empower you. I have to say, especially my Black people, a lot of them do not know why they're taking certain things, and that is one population that I always take time to try to go through the medication list with them, go through the blood tests with them, their blood test results, their x-ray results, go through it in detail. Sometimes I even give them a copy of those results. So that's a key for me, is advocating for yourself during any type of clinical visit. Okay. I think that's it for today. I have more that I would love to talk about it. So I will be putting more videos out on that. I hope that this little message helped a lot. If it does, please let me know. I can continue. Okay. Have a great day, and see you next time. Please like and subscribe to my channel. Bye bye. See my little baby over there.